My name is Victoria Dehart, and this is my recorded community presentation. The community that is being explored through this presentation is Catawba County, that is located in North Carolina. You can see on the right side a map of Catawba County and the surrounding counties. The target audience includes a suburban setting and is primarily agriculture, with the county's farming industry being a huge plus to the economy. The estimated population of the county in 2023 was 100,064 and 645 residents. The demographics of this population is calculated to be made up of predominantly white, being about 83%, and that's followed by Hispanic and Latino, and then the least amount being African American, which is only 9% of the population. Education-wise, most of the population is believed to have graduated high school or received higher education. And as far as employment goes, the unemployment rate is estimated to be about 5.9% and tends to follow the unemployment rate of North Carolina. As far as health resources go, it's estimated that 12% of the population, and this includes those over 65, um, are without health insurance, and then 12% of the population of all ages live in poverty. A health profile was composed in 2019 that found that 14.6% of the county's population received SNAP benefits within the past year. Catawba County is considered to be a food desert. This means that certain parts have limited access to food. About 14,151 residents fall into this category of being in a food desert. And although they're considered to be a food desert, there are still various grocery stores, farmers markets, and healthcare systems located in the area. There are also several hospitals, such as Catawba Valley Medical Center, which there's a picture of that on the right, and then Fry Regional Medical Center. And then each of these have registered dietitians within them and various outpatient services. My personal connection to the area is very extensive. I have been a resident of Catawba County since 2001, when I was born, and then several generations past as well. Not only have I been a patient of multiple healthcare systems across the county, but currently I am a dietetic intern at Catawba Valley Medical Center. Through this role, I have learned more nutritional and health insight on the community, as well as how these healthcare organizations run in general. I worked in the Catawba County school system as well as a substitute teacher, and I have been a consumer at the various grocery stores and food producers of the area. I was diagnosed with severe eczema at a young age and visited many of these healthcare providers in the area where I was given prescriptions that helped temporarily but left me without a long-term solution. I eventually placed myself on the eczema diet, which is a exclusion diet of gluten, dairy, and red meat. And this controlled my condition long term. But from all these experience, I can personally see and feel the needs of the community relating to nutrition. This leads me to the introduction of the problem at hand. So within the community of Catawba County, there is a lack of access to nutrition care for those with allergens or intolerances stemming from the overall lack of nutritional awareness and knowledge within the area. Although there is a large amount of healthcare providers in the area, there is limited nutrition clinics. Most nutrition-based practices that exist in the county are focused on weight loss or outpatient services connected to the hospital, and these usually focus on nutrition-related diseases such as diabetes or heart disease. The type of establishment that the community is lacking is one based on nutrition for those with problems outside of the typical disease domains, such as those with allergies or intolerances. Data suggests that about 10% of people have some sort of food allergy. And then on the right, you can see the top 9 food allergens. And when there's failure to acknowledge or properly diagnose and treat these allergies or intolerances, A variety of complications can arise, such as improper growth in children, extreme discomfort, decreased quality of life, and a wide range of health issues. Some examples of the issues that directly affect the skin are psoriasis, atopic dermatitis, dermatitis, dermatitis herpetiformis, and acne. As seen from these various examples, nutrition is not only dire for those with various diseases, but also hugely displayed in biological processes that influence the skin. Other examples of nutrition issues that the clinic would aim to help would be celiac disease and GERD. Those are just two of the examples. This problem directly links the community of Catawba County in the way that they are extremely limited in facilities where those who have the previously stated issues can find long-term help. This lack of intervention leads to growing numbers of those living with food intolerance and allergy complications. The proposed solution at hand, according to the problem above, is clinics specializing in food intolerance and allergies. This proposed solution will not only open the community's minds to the healing power of nutrition, but it will also work to decrease the number of those living with these issues without a means to aid them. The relevance of this solution, considering the community of Catawba County, is the way in which knowledge will spread to those in an area where resources may be limited. Um, with about 12% of the area's population being in poverty, it would be imperative to form a clinic that is based on this specific statistic. Many other residents may not follow recommended diet guidelines due to the cost of these type of foods. However, this clinic will offer education on how to heal while also staying in budget and using the county's resources around them. The call to action and the implementation of the solution to the problem, the specific population will be children and adolescents. Um, This group is found to have an increased chance to have a food allergy, about 6 to 10% of the population. Also, during younger years, it is easier to differentiate and notice the symptoms of food allergies and intolerances. This time of life is when complications will arise from undiagnosed issues and can lead to severe complications such as insufficient growth. The timing of the proposal is imperative, and the carryout date would be set to December of next year due to healthcare facilities census being the highest during this time. As far as the steps go within the process, the first step would be meeting with healthcare providers in the area to get their view and idea of acceptance of nutrition and dietetics. The next step would then be to focus on recruitment strategies, and the preferred strategy would be to propose the idea of referrals to them by bringing the facts in the preferred form of learning method for healthcare professional, and this would be evidence-based facts. The goal of this step would be knowing that there will be ample support of healthcare professionals in the community, which this also shows the participants that they have the trust of their healthcare provider as well. After this has been successful, the dynamic will then be set for the clinic as far as interdisciplinary team cooperation and the flow of appointments. The outcome of the visit will be that a patient leaves with a newfound knowledge on nutrition and how to apply that to their lives to see change. As far as resources go, the resources that will be needed to carry out all these tasks would be other dietitians to partner with to share knowledge and add experience. And then maybe having a dietitian who has worked with referrals could aid in the process of connection. Education materials is another needed resource. This will be given to patients to help them remember and apply their knowledge, learn to everyday life. And then a building or a space for the clinic would be the biggest resource because its location would need to be at an accessible area for all patients. Technology would also be needed to aid in data collection, charting, and as a communication method to those um, needing the clinic's assistance. This also allows a wider range of access for people who may not be able to come in but can use telehealth. Also, Zoom calls can be used through the telehealth as well. Um, and then funding is going to be crucial. It's always crucial in starting a business to have funding. So, with the support of healthcare professionals, hopefully, connections will be made to larger organizations, and then these could help to aid in funding, with benefit to their cooperation by our services. This would need to be completed prior to the implementation of the clinic. However, there are some funding options that could come later with an increase in business, such as the option to be half PRM based and go to these partnered health organizations to offer services. Also, partnerships could be established with food brands specializing in food allergies and intolerances where we sell their products, and then both ends will benefit. And then the way that we're going to measure the success